Hey, YouTube fam, out here ripping and running and ripping in these streets. Um, Feeling like Pizza Hut tonight, so I'm over here about to pick me up a pizza. Um, just wanted to drop in and talk about health for a little bit. It's ladies, it's breast cancer awareness month, October. So make sure you get your mammograms done. I've already had mine done this month. Everything came back great. To go back in a year. Don't let these doctors talk you out of not getting them. When you hit the age of 40, definitely get your mammograms every single year. In 2019, my doctor told me, oh, you don't have to actually do it every year. You can even skip a year if you want. I said, no, I'm not going to do that because my mother was diagnosed with breast cancer when she was in her early 60s. So I'm not skipping out on anything. I'm gonna do this every year. So, and thank goodness I went on ahead and did my October 2019 mammogram because it came back showing that I had a little suspicious finding inside of my left breast, and I needed to have it biopsied. So I went to go have it biopsied. They did, the surgeon wanted to go ahead and remove it because it was something that had a potential to turn into cancer later. So I'm thinking, I'm like, if I would have listened to her, who knows where I would be today. By skipping that year, the 2019 mammogram. That's why we have health insurance. Fight for your health. Fight to get things done. Don't let anybody tell you about your body. Also, pain is not good. You're not supposed to be in any kind of pain. And if you're always in some pain, they need to figure out where it's coming from. But pain is not normal. So don't let people try to get in your head and tell you things when, always get yourself fully checked out. And as far as everybody, make sure when you hit the age of 45 to get your colon cancer screenings done. I know people are afraid, of cameras going up the wazoo there, but that's not the worst part. The worst part is actually just drinking the stuff, to be honest. I'm going to be completely honest with you, is drinking the prep. Because it doesn't taste that good. There's ways you can kind of trick it and drink like some Sprite with it or whatever. But you can get it done to get cleaned out. You can do a clear liquid diet for some days. But that's an important test to get done. Don't listen to these commercials that tell you about this Cologuard test where you can do the self-screening at home and you mail it in and all of that. Don't do Cologuard. If you guys were my blood relatives, best friends, I would never do Cologuard because let me tell you one thing. If you have a polyp inside of your colon and that polyp is not bleeding, Cologuard is not going to detect that polyp. So what's going to happen is that polyp is going to continue growing. It could be a benign precancerous polyp to start off. But when benign precancerous just means it has a potential to turn into a colon cancer polyp. So the best thing to do is just go ahead and get the full colonoscopy where they actually put the scope inside and look. And that way you can be in the clear. If you don't have any polyps, you're good for 10 years. You don't have to do it for 10 years. If they find like a benign, it's called a hyperplastic polyp, which is completely benign. It never turns into anything. You can come back in 10 years. Now, if you have one, I had one in September of 2021. And I had a little tiny polyp, and it was a tubular adenoma polyp, which is a benign precancerous polyp. So it was really small. So I get to come back in 7 years. So I'll actually go back in 2028. But, again, and I wasn't having any bleeding. I wasn't having any kind of symptoms to let me know that polyp was inside. No clue whatsoever. They don't cause any pain or anything. So, the best thing for you to do is to just go ahead and just get the full colonoscopy done. So that's pretty much it. I just wanted to talk about, just make sure you be on top of your health. And also, we got to take care of our teeth. Make sure you go see a dentist every 6 months, get a cleaning done, because your teeth also can affect your health too. Some people wouldn't think so, but yeah, it does. I mean, you know, it can start messing with your heart. If your teeth are bad, you have a bad like infection or something like that, you know, go get your teeth. I know people, there was my nephew has a cousin that died because he had a really bad abscess in his mouth. And he was young. The dude was like in his 20s, his late 20s. So sad. But he didn't take care of his teeth. He just kept ignoring it. So yeah, just wanted to let you know, be up on your health. And you know, we have health insurance for a reason, people. Go ahead and use it. All right, well, you guys have a good day. I'm gonna go see if this pizza is ready. And if nobody's told you they loved you today, I love you.